Hey, everybody. So I'm going to start with our midterm study guide. Okay. So the number one and number two is exactly the same. It's a vaccine schedule question, also the calculation question. So it is not going to be difficult. So don't worry too much. Okay. Just like what we practice in the quiz and also when we in the class. Okay. So if you just feel a little bit fear, just calculate twice. Okay. Just get some time. So let's start with the number three. So why congenital heart disease is a high risk for the endocarditis? So this is the reason we're telling you, okay, so the kids, their heart is not functioning very well, the immune system is low. So that means the spatial bacteria, the streptococcus will get into the blood very, very easy. That's why we'll cause the endocarditis, okay? So be aware, so what kind of bacteria and why is the reason and we'll get endocarditis for this kind of like a heart failure disease, okay? Number four, infant with a congenital heart disease will prescribe digoxin and the potassium is low. Intervention. What should you do? So remember before we take we are taking the exam the quiz about like what is a sign and a symptom about like potassium is low, right? But this time the question changed a little bit and say potassium is already low. So your intervention is what? What should you need to do? So remember this pediatric is infant, okay? So that means that this could be a little bit critical. So that's why what you need to do. So you probably need to escalate. You need to escalate and telling somebody to do something. All right, number five, if arterial septal defect in an infant, so if this infant is not eating well, so what will happen later? Think about the nutrition problem, okay? Think about this. So the baby is not eating. So this is such a big problem, right? So it's not receive any nutrition. What will happen to this baby with a nutrition problem? So this question actually is not difficult, very, very easy. Just pick the if the long term the baby is not eating, so like a couple of weeks is not eating very well, it will cause some kind of problem. The whole system is going to be falling apart. That part is some kind of like a special medical term, okay? So that's why you pick that answer. That answer is telling you, okay, the nutrition is not enough for a while. Okay, it's a special medical term. All right. Cardiology of a fellow is experiencing sudden hyperkinetic spell. So your intervention. So that means what? This baby actually just not receive the oxygen very well, and suddenly just become like a blue baby. Okay, and maybe just become like a purple on the lip. So what will you need to do immediately? So remember something, okay? What kind of position you need to do, and what you can give. Can you give something or what kind of position you're going to put a baby? Okay, this is the hint. All right. Corroboration of the aorta blood pressure. Okay, so they are telling you, okay, for this kind of like a congenital heart disease, is very special thing is what happened to the upper arm and lower arm extremity when you taking the blood pressure. What will happen like this? Okay, with this disease. So what happened to the upper arm blood pressure and what happened to the lower leg blood pressure? Think about what will happen. Okay, this is a big hint here. So not difficult. Just think about what effect to the upper arm and the lower leg. So 8. Congenital heart disease worsening hydration status. So you need to see the sign and symptom, okay, and also also your nursing intervention. What will happen to the functional if there are dehydration? So how many type of change you think is kind of necessary, and you feel like okay, diaper change is not enough, so it's going to show you dehydration. How about the skin condition, the trigger, the body weight daily, and the intake and output? How can you just see the intake and output? The change is showing the baby is dehydration, and that's why you need to pay attention about that. All right. Number 9, ventricular septal defect. So is ineffective cardiac output. What does that mean? Okay, what does that mean? So what happened to the apical and the radical pulse? So what will happen to that? So that means what? So the radical pulse and also the apical pulse actually maybe have something change. So why we need to check apical pulse? Why we cannot rely on radical pulse? Okay, think about this. So especially this is a heart disease. So heart is not pumping very well. So that's why So these two pause could be different. So this is the reason, okay, why we use the apical pause. Think about it, okay? Number 10, Kawasaki disease, the serious complication. Okay, I give it a very strong hint. What will happen to the artery? This is danger. Okay, this is danger. So the baby will die immediately if something happened to the artery. So go back to the PowerPoint to find out. So Kawasaki disease, the serious complication. Okay, remember I tell you guys highlight the rate 1 layer. Okay, be careful, the artery will happen something. That's a very severe disease, a severe symptom. Number 11, the picky eating kids with the iron deficiency, the diet choice. So is a red meat is a good thing. So that means what? These kids not eating certain of food and actually the is not getting a lot of iron, become like anemia. So that's why they want you choose the food for the kids. So that's why choose the right food for the kids. Okay. So what kind of food is a rich iron for the kids? So is red meat is a good one for the kids? Yes or no? Think about it. So 12, the child experiencing a sickle cell crisis, the danger vital sign. So think about it. Sickle cell crisis, what will happen? What will happen to the sickle cell crisis? We talk about the pain a lot, right? But how about the vital sign? So do you think about sickle cell crisis will change some kind of vital sign? Yes, they will change certain of vital sign. And the vital sign actually is telling you the patient is in some kind of crisis right now. Pain medication maybe is not helping not so much. So that's why you need to do something else, okay? So remember, this is red blood cell. The red blood cell, if they cannot carry the oxygen, so what will happen to this patient in the vital sign? Think about it, okay? Not that difficult. Think about it. It's a vital sign change. Number 13, a child with a hemophilia. So what school sport choice is better for these kids? Okay, remember something, hemophilia, we don't encourage this patient to go do some kind of like impact exercise. Okay, that bumping each other, they'll get bruised or bleeding very easy. So the school is going to assign these kids to have some kind of exercise program. So think about what kind of like exercise or sports is better choice for these kids if they have a hemophilia. Okay. The 14, the concern of a chemotherapy for the Hopkins disease. So the Hopkins disease is some kind of like a cancer for this pediatrics. So if the kid is receiving the chemotherapies in the hospital, so what's your concern for the chemo? Remember, the chemo will cause the whole blood decrease, okay? The red blood cell decrease, the white blood cell decrease, and the platelet decrease will cause 3 different kind of problem. So that's why your concern is this 3 problem. Okay, the answer is one of them. So I kind of tell you the answer already, okay? Just read the PowerPoint, you will find out the answer. It's not a hard, okay? Nursing action with the HIV mom breastfeeding the baby. So how can you tell the mom have HIV? How can she feed the baby? Can she breastfeeding the baby? Okay, is breastfeeding you need to have like a special program for the mom? So is mom feeding the baby with HIV and with a treatment or without a treatment? What do you think? This is kind of necessary. Okay, the answer is there. This is what I tell you. Okay, so some people can breastfeeding, some people cannot do the breastfeeding. Okay, that's why your nursing intervention you need to teach the mother yes or no. The 16, Junoville, like a arthritis, the diet choice. So they're going to asking you this kind of arthritis for the patient, what kind of diet is better for this patient? Okay, this is some kind of like a rheumatoid arthritis. So that's why going back to see your PowerPoint, and you're going to see this patient, what's their condition. So what kind of food is better for them? They can eat this kind of food. All right, 17, corticosteroid mechanism for the respiratory distress syndrome. That means what? The baby was born with this kind of disease, RDS. So remember, so the steroid medication is helping something get mature, right? We say it's for the whole body, but especially for one organ. That organ need to get mature. That's why baby can breathe better. What's organ? We use a steroid to make a baby have more mature for that organ. Okay, think about it. Is this okay high concentrated oxygen therapy for the infant? So this question coming back again. So that's why I think about it. So is a high concentration oxygen is that necessary for the baby? Yes or no? Okay, you pick an answer. Okay. Be careful. The answer is in the question. The answer is there. So they have one correct answer there. Okay, 6. Sleeping environment. So that means this baby will be suddenly die in a sleeping environment. So in this environment, how can you arrange it with this environment? Okay, do you put some kind of extra toy or the blanket around the baby? Sleeping with the baby, is that okay? So where baby is sleeping is okay. Yeah. So the baby in the grave is better or in the bed is better. Okay, this is like a PowerPoint I show you already. So everything's there. Okay, think about it. How is the safety for this baby? 20. How to differentiate between the viral and the bacterial pharyngitis. So that means what? The pharyngitis have like the popping cough, right? But here is the thing. How can you know it's a virus or bacterial? By one diagnosis exam. This is asking you by one diagnosis exam, then we can find it very easy. Okay, then we'll find out, okay, it's viral or bacterial. That's what we can decide. We want to give an antibiotic or just a palliative treatment. 21. Bacterial tonsillitis, completing the medication course reason. So what's the reason? That's why it's a tonsillitis. And then we're telling the patient complete with your medication is very important. This is bacteria, okay? So now that's why you understand, because this medication need to be complete with the whole course. Why? This is the reason. I cannot tell you the medication. That's because that's the answer. So that's why. If we have a bacterial infection, what medication we use? That's why you need to finish with the whole course. Okay, that's the reason. 22. The viral crop priority nursing action. Patient cannot breathe very well right now. What should you need to do? Okay, remember this. Patient cannot breathe and they come into the emergency, or you find out it's an emergency. And what should you do for the patient? They are not breathing very well. Can you do something? Oh, this is not checking the vital sign, do assessment anymore. No, this is action. You need to do something, okay? Can you give some oxygen? Can you call a cold blue team? Can you call a RT? Can you escalate the doctor? Can you just get some equipment quickly, okay? So answer is there, okay? This is also not that hard. So that's why be careful. So when you see all the answer, actually the answer need to be the action. Please do not pick assessment, okay? This is danger already. You have no time to assess this patient anymore. All right, 23. Epigolitis, the emergency sign. So what is the emergency sign for this patient? Do you think this patient can breathe? If it is emergency, think about it, okay? Emergency sign. How is the blood pressure? How is the other things? Which one vital sign is effective most likely? So that's why it's urgent. That's why you need to do the action right away. All right, 24. TB, kids return to the school policy. So remember, I tell you very important things. The school have a very strict policy for all the pediatric kids because they don't want kind of like a contagion just coming in the school, right? So these kids, the TB is very contagious. So that's why the doctor is providing treatment for these kids. So when these kids they coming back to the school have a certain policy. So they will need to check this kid is clear or not. So that means what? The school nurse is going to asking you provide some kind of evidence. Do you have that evidence? Okay, I need to see the evidence. So that's why the kids can coming back to the school. So remember, I tell you something very important. If you want to clear the TB patient, so what kind of diagnosis exam is necessary and how many times we need to see? Okay, how many times this diagnosis we need to see? Okay, I give the very strong hint already. How many times? Okay. 25. Environmental the factor for the children with risk of TB. So how can these kids will get a TB that's so easy? It means there's some kind of environment, right? So the environment is kind of like a danger for this kid. What kind of environment usually the people will get a TB very easy? Is it an open environment or lots of people living together and the patient in some kind of environment means maybe it's kind of toxic, has some pollution, or the patient just living in environment with kind of like a very wild, with all the farm together, very open. So thinking about which environment you compare together, and that environment is danger for these kids. That's the answer. Okay, that's the answer. Is a high risk for these kids. 26. School age child with a cystic fibrosis during the high and hot weather intervention. Remember, I told you the cystic fibrosis usually we pay attention on the lung and also the pancreas, right? But also have another condition is usually this patient will sweat a lot. Because it's excessive like a secretion, they will sweat a lot. We're losing lots of water and also sodium. So that means what? So these school kids in the school, they just play, just doing the exercise, okay? And it's very hot. So what should you do for these kids? If these kids have cystic fibrosis and you see these kids swelling crazy, what will you need to do? Okay, 27. Intervention with a child with a cystic fibrosis experience a thick mucus secretion. So you're gonna see this patient maybe have lots of secretion in the lung or in the trachea. Is a secretion a lot. So what should you need to do? Okay, can you try to do something to lose the mucus? Can you do something like take out the mucus? Okay, can you do that? So think about what you can do what can intervention helping for this patient. Maybe also give you some like a hydration, the fluid will sick the losing the mucus easy. 28. Advice for the child experiencing the asthma in the school. This is select all that apply. I'm not worried about this because it's exactly like a adult, okay? But here, give you some hint is, so when the kids have asthma and experience with the asthma, so something and think about this logic. So do we need to do something only or doing something totally? So that's become like a necessary or non-necessary. Do you thinking about this kid have an asthma trigger and then we would totally limit it with all this kind of animal touching with the kids? Animal is one of trigger, yes, but do you think this is kind of necessary? The patient is under control and we just don't let the kids touch any animal. How about the animal at home? The indoor animal is very nice and clean. Do you think this is also necessary? How about the dust? How about some kind of exercise on the field? And how about how to use the medication? Okay, do you think about the kids need to bring the medication all the time? Is that necessary? Okay, how can they use the medication? How can you teach the patient, parent? Do you think that about provide education for the parents is also necessary? Yes or no? So this is that all that apply. 29. Education parents about like a management of hypothyroidism children. Okay, so the children have a hypothyroidism. So we are going to telling the parents how can just manage it with these children. So for sure, these children will need some medication, right? But here is the thing. Is it the medication is prolonged forever? I will just take in a very short time. So the parent tell you, oh, when the kids get better, I will start the medication. Is that a good statement? Is that correct? So how we taking this medication for these kids? How can they just take it? It's because maybe it's a thyroid medication. Do you take it with an anti-stomach or with a food together? So if this kid have some kind of side symptom, okay, how you management with this side symptom? For example, thyroid medication will trigger some vital sign going high. Okay, how is the blood pressure? How is the heart rate? So how will you take care of this patient and also tell the parent how you management or the monitor with this type of symptom? So that will be your education to the parents. Okay. 30. The parents understand the child with the type 1 diabetes, the disease progress. So the parents actually will tell you something about how they understand type 1 diabetes. Remember, this is type 1 diabetes. The child born with this disease. Do you think that can be cured? Okay, so the parent is going to tell you something. Okay, the type 1 diabetes, the some symptom cannot be cured or not. Or you're thinking about the type 1 diabetes and type 2 diabetes, they are thinking about exactly the same. Is type 1 diabetes and type 2 diabetes, are they the same? Are they the really same? So the management could be a little bit different, okay, especially the medication. Do you think this patient will need insulin for the whole of their life? Yes or no? So that's why parents are going to tell you something about this. Do you think this patient still will release the insulin? Is that possible? So the parent is going to asking you this question, will tell you, okay, their understanding. Okay, so this is also teaching. 31. Type 1 diabetes prevent the complication during the sick day. Okay, this one a little bit difficult. That's why I give you some kind of very good hint. So, do you think the sick day we should skip the insulin? The sick day could be like a blood sugar high, it could be blood sugar low. Okay, but do you think that skip the insulin is a good idea? So how about increasing the exercise? Okay, just tell the patient, okay, you know what, your sugar is high, just go outside exercise, you'll be fine. Do you think that statement is correct? So totally no carbohydrate. So if the sugar is high, I don't want you to eat any carbohydrate, nothing at all. Is that correct? So only high sugar food, is that also good? So if the blood sugar is a bit low, I only give the high sugar food. You don't need to take anything, no protein, no fat. Okay, just sugar food. Is that correct? Do you think we still need to check blood sugar? Okay, even in the sick day, I know the patient is sugar low or sugar is high. Do you think that checking the blood sugar is a good practice? Yes or no? So that's why we kind of like pick one of the answer during the diabetes sick day. Okay. 32. Intervention supports nutrition in the infant with the cleft lip. Okay, this baby have like also nutrition problem because they cannot eat very well. They have an opening on the lip or opening on the cleft. So the baby, do you think about the baby can feed themselves? Do you think it's possible? You think it can make sense? The baby can feed themselves. They are not going to drawing with any meal. Is that possible? So the bigger wide the base of a nipple, do you think is better? Do you think we can just cover the baby, the mouth, the whole mouth is better, seal it is better? Do you think this baby can eat by the spoon? Is that making sense? Is that possible? Okay. Do you think about the baby still can be the breastfeeding? Is that good? Do you want to take out the breastfeeding? You want to take out the mommy and the baby's bonding relationship? Is that good? So think about this, okay? So the baby have an eating problem. So how can we feed the baby? This one is better. So the answer is also in your PowerPoint. Is highlighted with a red one, okay? Okay, so priority stenosis. So typical sign symptom. So that means what? The food is not going to your intestine, so it's going to accumulate in your stomach. So what will happen the patient after you keep feeding and then the patient will vomit? So there's very special vomiting in this patient. Very special vomiting in this patient. What kind of vomiting is this one? Is this disease? Very typical. Okay, very typical. So I need to choose that vomiting. Okay, I don't want a normal vomiting. That's a special vomiting I want you to pick. 34. Feeding intervention for an infant after the polyromyopathy. So that means what? We just cut the muscle from your stomach. That's why I can open the stomach. The food will go to your intestine. So what diet usually we feed after the surgery? So the baby just done the surgery. So how can you provide the nutrition? So that's why don't get exciting right away. Oh, now baby can eat right now. So let me give the whole food. Do you think that's appropriate? Do you think the parents suddenly just tell you, okay, now my baby can eat right now. Let me give the whole milk right now. Let me feed the patient. Let me feed the baby with like a solid food. Do you think that kind of making sense? Yes or no? So what diet usually we feed the baby after surgery? So actually not just baby after the surgery for the adult, the same. What diet usually we started with from the beginning? All right, the 35. This is also a very special disease. Your colon is missing with a nerve, right? So Burger, okay, whatever. So experience like abdominal distending. So what intervention is necessary? I'm telling you this very important thing is necessary. I don't want you pick something is not kind of like necessary. So do you think about this baby? You still want to keep feeding them? Okay, so do you want to choose other food? Okay, maybe the baby just choose like a low fiber food, diet food, or high calorie food. I choose any kind of higher food. Do you think that can making sense? The baby have this kind of problem, they're still eating and keep eating with all different kind of food. Do you feel like put on the NG2 is necessary? How about the NPO? And how about the surgery? Okay, so which one you feel like is necessary for this baby? Remember, I tell you, sometimes we got nothing to do, only that thing will be happen. That's why the patient will go to that procedure. So that's why this disease also, we have nothing to do with this baby. They only go to one procedure. What procedure usually they will need? Okay, so this is certified question. So I'm going to upload to the YouTube very soon. So remember, just go to check your YouTube. Okay, and if you just have any problem, usually it's in your PowerPoint. So that's why I did not just go away with our PowerPoint. Okay, I'm working tonight. So if you have a question, please remember just ask me in the class tomorrow. Thank you. So good luck.